Okay, so we're going to start talking about symptoms of hormone imbalance, and please feel free to keep eating or get up if you need to. Those of you who know me know I keep a pretty tight schedule because I really respect people's time, and we do finish on time. So we're going to talk about symptoms of hormone imbalance. We're going to start off by talking about something that is colloquially known as estrogen dominance, which means too much estrogen relative to progesterone. The causes of estrogen dominance or too much estrogen relative to progesterone: high estrogen production, too much, or excess supplementation. Lack of ovulation. Remember, if you don't ovulate, you don't make progesterone, you can end up with estrogen dominance. Stress, which you now know increases fat tissue and depletes progesterone. And exposure to xenoestrogens. So these are chemicals in the environment that mimic estrogen in an unhealthy way in the human body. Symptoms of estrogen dominance or too much estrogen relative to progesterone include mood swings, PMS, anxiety and depression, fatigue, or food cravings. And that's PMS Barbie. You can see she's a little bloated. She can't do her pants. She's got a very nice word on her shirt. Craving the chocolate, has the Kleenex because of the mood issues. PMS Barbie. So here's $1 million idea for anyone looking for a business. Where is menopausal Barbie? And andropausal Ken? Where is she? Wouldn't everyone buy that? I would buy that. Okay, so breast tenderness. That can happen with estrogen dominance. Uterine fibroids. Too much estrogen fuels the fibroid getting bigger. Heavy periods. So too much estrogen without enough progesterone causes the uterine lining to thicken, which means you end up having a heavy period. Weight gain, water retention, or bloating. And headaches, especially before the period. Headaches right before the period also can be due to a rapid drop in estrogen. Really easily treated. Anyone who has menstrual migraines, very easy to treat. The 7 Dwarfs of Menopause. Let's talk about symptoms of menopause. This is from Suzanne Summers' book, Itchy, Bitchy, Sweaty, Sleepy, Bloated, Forgetful, and Psycho. Anybody identify? There's a bumper sticker I've actually seen that says, "I'm out of estrogen and I have a gun." So estrogen levels, you now know, decline in women as they age. Postmenopausal women make estrogen from testosterone and androstenedione from their adrenals. Hot flashes and night sweats, probably the most identifiable symptom of menopause or low estrogen. These are called vasomotor symptoms. They can be caused by low estrogen. They can also be caused by estrogen fluctuation, so not necessarily just low estrogen, and they're worse with stress. Other estrogen deficiency symptoms: memory problems. Remember that the hippocampus needs estrogen to form new memory, so things like, what was I just about to say? Words vanish, names, trouble with names, where did I park my car? Foggy thinking. Depression, very common with low estrogen. So sometimes it's not due to a Prozac deficiency or fill in the blank with any other SSRI. It could be due to low estrogen. Anxiety, really common. And emotional mood swings. So some women will describe this as not being very loving. So estrogen raises something in the brain called oxytocin. And oxytocin is the hormone that makes us want to connect. It's the hormone that, ladies, when you were pregnant and gave birth, it was the hormone that made you fall in love with your baby. So when our estrogen declines, our oxytocin declines. Suddenly we take a step back, we're not as interested in connecting, maybe we become socially isolated, and we're certainly not looking at the best in other people. Other estrogen deficiency symptoms: urinary infections and urinary incontinence. This is because the urethra is surrounded by tissue that's estrogen sensitive, needs estrogen to keep it taut. So if you don't have enough estrogen, you can have leaking of urine. Increased risk for urinary tract infections because the bacteria can ascend. Vaginal dryness, sleep problems, bone loss, joint pain, also very common with low testosterone, and loss of skin elasticity, otherwise known as wrinkles. Another Randy Glassbergen cartoon. Frankly, I wouldn't mind the insomnia at all if I hadn't lost my libido at the same time. Remember, we are not programmed for longevity. We're programmed for procreative success. Testosterone deficiency symptoms. You'll notice a male and female symbol there. That's because these symptoms can be seen in both men and women who have low testosterone. Depression. Trouble focusing and concentrating. Remember, testosterone necessary to make enough dopamine or for its release. Memory problems, lack of energy, lack of sense of well-being. This is something that's hard to define, but you know when you don't have it anymore. Low libido, so sex drive and also passion in the world. Low motivation also. Bone loss, loss of muscle mass, and joint pain. Really common symptom to have joint pain when testosterone is low, because testosterone can help lubricate the joints. Tends to go away with testosterone repletion. Other things that are associated with testosterone deficiency: an increased BMI or body mass index and waist to hip ratio, increased insulin levels, increased blood sugar, increased triglycerides, increased LDL or bad cholesterol, increased blood pressure, and increased fibrinogen or stickiness of the blood. Therefore, an increased risk for diabetes, heart disease, and strokes. Bone loss. So this can be seen in men and women, much more common in women. Bone loss can be from low estrogen, low testosterone, low growth hormone, or too much cortisol. And we're going to be talking a little bit about bone loss later, because I make a big deal about bone loss in women.